What if you pass a genetic mutation to your kids? What happens if you pass a genetic mutation to your children? This is a question many parents think about when considering their family's health. Let's break this down in simple terms. A genetic mutation is a change in the DNA sequence that can affect how a gene works. When you pass a mutation to your kids, they inherit an altered gene from you. This can impact their health in different ways, depending on the type of mutation and the specific gene involved. Genes come in pairs, with one coming from each parent. Sometimes, a mutation may be present in just one copy of a gene. If a child inherits a mutation linked to a health condition, they might have a higher chance of developing that condition. For example, some mutations can lead to hereditary disorders or increase the risk of diseases like certain cancers. There are different ways mutations can be inherited. With autosomal dominant mutations, if you have a mutation in one copy of a gene, there is a 50% chance of passing it to each child. Those who inherit the mutation may develop the related condition, but the severity can differ. On the other hand, autosomal recessive mutations requiring both parents to carry a mutation in the same gene for a child to have a 25% chance of inheriting the condition. Children who inherit only one mutated gene are carriers but usually do not show any symptoms. Sometimes, mutations occur spontaneously in a child and are not inherited from either parent. These are called de novo mutations. The risk of passing these to future children is generally low, but it can vary if a parent has a mutation present in some reproductive cells. Inherited mutations can increase the risk of diseases like cancer. For instance, mutations in genes responsible for repairing DNA damage can raise cancer risk because cells are less able to fix genetic errors. However, not all inherited mutations lead to disease. Some may increase risk but do not guarantee illness. Understanding inherited mutations can help with proactive health management. This might include increased screening or preventive measures. Genetic testing can identify mutations in parents and children, helping assess risks for hereditary conditions. Personalized risk assessments can give families more accurate information about the likelihood of passing mutations to future children. This knowledge supports informed decision-making about family planning and health monitoring. So, if you pass a genetic mutation to your kids, it means they inherit a gene change that may affect their health. The risks depend on the type of mutation and how it is inherited. Family genetic testing and counseling can be helpful tools to understand and manage these risks effectively.